Good morning all. Please take your seats now and we'll make a start to the proceedings. Good morning all. I'd like to begin today's proceedings by acknowledging that we are meeting on the traditional lands of the Ngunnawal and Ngambri peoples, and to pay respects to their elders past and present. I would like to extend that respect to the Aboriginal and Torres Strait Islander people present today, and to acknowledge the lands of the people joining remotely and watching the recording. I'd also like to acknowledge the knowledge and the wisdom of people with lived experience of an eating disorder in the room today. Thank you to those with lived experience who contributed vital insights and directions to the Paying the Price report. The strength and sense of direction of people with lived experience and carers and supports provides invaluable leadership across the eating disorder sector in the shared work of improving the experiences and outcomes of people at risk of or experiencing an eating disorder. My name is Dr. Beth Shelton, and I'm the National Director of the National Eating Disorder Collaboration. It's a pleasure to be invited here today to help Butterfly Foundation to launch the Paying the Price 24. Today we'll hear up-to-date data about the economic and social costs of eating disorders for Australians. We'll consider directions forward, hearing from government leaders, from people with lived experience of an eating disorder, and from the Butterfly Foundation and Deloitte, partners in the generation of this report. I just want to acknowledge that we will be talking about eating disorders today, and some content can be difficult or triggering for particular people. If this is difficult or distressing for you, please do reach out to any of the Butterfly staff who are here for support. We're joined today by many special guests, including members of Parliament and senators. In particular, I'd like to acknowledge the representative of the government, Assistant Minister for Mental Health and Suicide Prevention, Emma McBride, and the representative of the opposition, Senator the Honourable Anne Rushton, both of whom will be speaking to us this morning. I also welcome Melissa McIntosh, Shadow Assistant Minister for Mental Health and Suicide Prevention, and I'm pleased to say that we are also joined by the ACT Minister for Mental Health, Emma Davidson, and by the three co-chairs of the Parliamentary Friends of Eating Disorders Awareness Group, Andrew Wallace, Zoe Daniels, and Susan Templeman, and by many leaders in the eating disorder field. I'll now hand over to the hosts of today's events, Mr. Jim Hungerford, Butterfly's CEO, and the three co-chairs of the Parliamentary Friends of Eating Disorders Awareness Group to highlight key findings and implications of Paying the Price 24.
Thank you so much, Beth. And thank you for doing our acknowledgement of country. I would also like to acknowledge the traditional custodians of the lands that we're on, and also to recognise the importance of people with lived experience in everything that Butterfly does, and for the whole reason why we're all here this morning. I'd particularly like to thank the co-chairs of the Parliamentary Friends of Eating Disorder Awareness for co-hosting this morning's event with us and for recognising the importance of this report and the information that it provides. I'd also like to thank Assistant Minister McBride and Senator Ruston for their participation this morning and in recognising and lending their support in seeing the importance of eating disorders and our understanding of those. We're also honoured this morning to be joined by several members of the Butterfly board, by Claire Middleton, Butterfly's founder, and also key donors who've made the report that we'll be hearing about this morning possible. So as you heard from Beth, today we're releasing the second edition of Paying the Price, a report that chronicles the immense impact that eating disorders take on Australian society. The headline figures are alarming. We now have 1.1 million Australians living with an eating disorder. The economic cost has grown to $67 billion per year. The incidence of eating disorders in our society has increased by 21% since the last report, and the total economic cost has increased by 36%. And alarmingly, the age of onset is moving earlier. Now, people aged 15 to 19 have the highest incidence of eating disorders among the Australian population. These figures really underscore the critical importance of acting now to address this public health crisis. Investment is critically needed in therapy and support, but also in prevention and early intervention. We very much hope that the launch of the report this morning and then the conversations that follow will serve as a catalyst for Australia to take action on this emergency. Thank you. Sorry, that was my fault. I should have handed over to our co-chairs. My apologies.
Well, good morning, ladies and gentlemen. Thank you so much for getting up nice and early in this beautiful Canberra morning. My name's Andrew Wallace. I'm the federal member for Fisher. I have a lived experience with eating disorders, so I come at things from a 20-year experience. And this report is very telling, it's damning. 1,273 people died last year from an eating disorder. 1,273 people, that's reported to have died, and I would suggest that there are countless more, multiplied factor of people who died from complications arising from eating disorders. Eating disorders are still taboo. We don't like to talk about them, and yet more people die from eating disorders than are killed on our roads each year. How can that be? The cost, as a result of this report, some $67 billion to the economy, but with each person, with each figure, there's a family behind this. There's a person, there's the sufferer, there's the mum and dad, there's the grandparents, there's the brothers and sisters, there's the colleagues, the co-workers who all go through this hideous and heinous disease. We as parliamentarians, and I'm very capably assisted this morning by my co-chairs, Susan Templeton and Zoe Daniels, who do great work in their own electorates and nationally in relation to this issue. But we have a responsibility, as do all of you, to continue to keep this on the front page. And we are so fortunate here today to have so many luminaries here in the eating disorder space. I want to single out in particular Jim, who's the head of Butterfly. I was just at Wandie Nerida about 2 weeks ago and seeing the great work that you guys do at Butterfly in my electorate there at Wandie Nerida. And Claire Middleton, where's Claire? Where are you, Claire? Claire, right there. Put your hand up, Claire, the founder of Butterfly. Thank you so much for what you've done with eating disorders. Belinda, put your hand up at the back. Eating Disorders Queensland also do great work, as do NDED in my own electorate with Mark and Gay Forbes. So there's a lot of work that is being done. Government needs to step up more on treatment, on research. I'm not going to beat up on government today, so relax, Emma. I'll hold that for another day. But we all need to stump up. We need to be doing more. It's an illness that we just have no idea what causes it or how best to treat it. I know So if anyone here is a clinician who wants to challenge me on that, I dare you. I dare you to challenge me that we know what we're doing in this space, because we don't. We need more research, we need more money, and we need more understanding. Thanks.
Good morning, everyone. And I know that for most of you who are here this morning, everything that you're going to hear is not going to be news. But very soon after the 2022 election, I was handed a baton by a teenage girl in my electorate, and I gave her a promise that I would elevate this issue. Let's talk eating disorders. And that's why we're here today. As Andrew said, we have to keep this on the front page. Since then, we've talked about this a lot, and I appreciate the effort and work that everyone in this room is putting into solving what is a difficult problem, but I refuse to see it as an intractable one. I have spoken to countless, particularly young women and girls and families in my electorate who have been stuck in the revolving door of hospital admissions and are looking for community in-home wraparound support in order to come out the other end of their eating disorder. And it's important that we focus on the hope, because there is hope for those who have lived experience from eating disorders. I appreciate the patience of Emma and also Mark Butler, the Health Minister, who have been relentlessly ear-bashed by me on this issue, and in line with the promise that I made to that young woman, that won't stop. And I do say to the government this morning, without being critical, because I know this is difficult, the evidence is now on the table. And I'm really excited to see this updated report this morning, because you can't fix something when you don't have the data. And $67 billion annually, and the per capita impact of that, and the numbers of 1.1 million people affected give us a jumping off point to take those actions. Not only education and prevention, but also better treatment pathways and supports for those with eating disorders and their families. And I'll finish by saying that although I've met with countless young people who have lived experience of eating disorders, in many ways, something that was particularly impactful for me was the first conversation that I had with a mum whose daughter had lived experience of an eating disorder. And sitting in my office in Melbourne in tears, she told me that she was on antidepressants, that she had given up her job in order to feed her child, that the marriage was in trouble, that they were struggling to pay the mortgage because she couldn't work, that other children in the family were also suffering from mental health issues, and that the family was on the brink of collapse. So 1.1 million people in the country right now with an eating disorder extrapolates to millions of Australians who are affected by eating disorders. This is a national crisis, and today is a day to step it up. Thank you for being here.
Well, you can see the passion that we as co-chairs have for this issue, and some of it is because, as Zoe describes, the stories that her community have shared with her. For others, it's because we've had some connection to this terrible some sort of eating disorder or disordered eating through our journey. And my journey with Butterfly actually began nearly 20 years ago when my daughter was a full-time ballet student as a 14-year-old in Sydney, and came to me and said, "Hey Mum, what's a laxative?" And that was the opening of a door into a particular environment where there was a lot of pressure on body image and to stay very, very slim. So I was very engaged with Butterfly through those years, my daughter's dancing years, helping to fundraise. She had friends who suffered terribly. and I really pay tribute to those early years of Butterfly. But congratulations to Butterfly on where you have now come with research and data that does help provide a base as we make decisions and as government makes decisions. Like Zoe and Andrew, I will be relentless in what I like to call nagging, that this issue is not left off the list of multiple priorities we have in the health and mental health space. I'm going to do something very dangerous, and that is I'm going to try and acknowledge the MPs here, because there are a lot who have just arrived, but Warren Ench has been here. I think you probably arrived on time, Warren. I can see Kate Chaney over at that table. Anne Ruston, thank you. You've been acknowledged, but you probably need to find your seat. I'm sure we'll do that for you. I can see Monique, Melissa, I've got Michelle here, Zoe came in, who am I? Oh, Helen Haynes, yes, I did see Helen here. And, oh yes, Allegra Spender. I think I've covered everybody. It's a terribly I mentioned Melissa. Yeah. Okay, it's a really scary thing to do that. It's not just not recognising them, it's having that blank about whose name it is. Yes, I've mentioned Michelle and Andaraj are there. Sitting next to Zali Stegel. Yes, I think I've covered it. Okay, but the person I'd really like to introduce you to is the Assistant Minister for Mental Health and Suicide Prevention and the Assistant Minister for Rural and Regional Health, Emma McBride. And Emma, you might like to stand and start making your way, because I worked out it's quite a long way from our table to here. But Emma's a registered pharmacist, and she brings to this role her health experience. She was a specialist mental health pharmacist and the chief pharmacist at Wyong Hospital for nearly a decade before coming to Parliament. And I am so grateful to have her in this role. Together, Mark Butler might not always be grateful that we share a passion, a really deep passion for these issues, but please join me in welcoming Emma to say a few words today.
Thank you, Susan, for that really warm introduction. I'd like to begin by acknowledging the traditional custodians of the land on which we meet, and to pay my respects to elders past, present and emerging, and to extend that respect to First Nations people who are here with us today. I'd also like to acknowledge those with a lived and living experience of eating disorders or disordered eating, in particular our special guests, Chantel Lacrosse and Sarah Cox. To the co-chairs, and you've all heard from them this morning, to Susan Templeman, Zoe Daniel, Andrew Wallace, for your relentless advocacy, for really raising the prominence and the profile of these issues within the Parliament and within the broader discourse. We know as a government and as a former government, and I acknowledge the Shadow Minister, Senator Anne Ruston here, and Andrew Wallace as someone who in the former government made a significant contribution, that this is something that, by the representation of MPs and senators here today, that so many people care deeply about, that so many people are committed to improving, and that collectively we will see some real change. To Melissa McIntosh, my shadow assistant, and to the ACT Minister as well, and of course to Jim Hungerford and to Claire for the power of work that you do. Today we welcome another important contribution to the growing evidence base on eating disorders. Serious, complex and life-threatening mental illnesses. The report, which will not be news to many people in this room, but it does paint a stark picture. More than 1 million Australians each year living with an eating disorder, a growing number of lives lost. The economic and social cost in our community now quantified in hard terms, an unmet need for support and treatment. I first became involved with eating disorders when a very close friend of mine was impacted in our first year of university and ended up, as Sarah knows, at the then unit at RPA. And Alice, unfortunately, is well today, and that is only because of the work of people like Professor Sarah Maguire at Inside Out, the research that they're contributing, to the people like Dr. Beth Shelton, our National Director of the National Eating Disorders Collaboration. I know this is something that everybody in this room cares deeply about, and there are many powerful advocates both here and in the state parliament. I was talking to my friend Emily Saval, a member of the New South Wales Parliament, who spoke powerfully in her first speech about her own lived experience and continues to use her platform, as you are, to really raise the prominence of these issues. And I would like to thank the Parliamentary Friends, the Butterfly, and everyone in this room for your ongoing engagement in what is a really complex and difficult issue for so many people. I just wanted to briefly touch on some of the work that the government's doing and that many of you have been a part of. Our government, like you in this room, are committed to improving the prevention, earlier detection of eating disorders and improving treatment and care, making sure that it's evidence-based, that it is up to date, and that we can collectively reduce the impact on individuals, communities and families. Given the complex nature of eating disorders, the only way that we know collectively, and Andrew spoke about the evidence or the paucity of evidence, is to make sure that all parts of the system are working together, from research to clinicians, to people with lived experience, to practitioners at the front line in communities. That's why we're really pleased to help launch the National Eating Disorder Strategy as a collaborative sector-led initiative, because that we know is the way that we will see a real change and real impact. The strategy builds on the government's investments across the sector, and I acknowledge the work, Andrew, of the previous government in this space. The National Eating Disorders Collaboration will lead sector-led consultation over the next 12 months to support implementation and identify the priority recommendations. And I want to particularly at this point acknowledge the work of Dr. Beth Shelton as the National Director of NEDIC. The government has committed $271 million across a broad range of initiatives to help improve just that identification, treatment and recovery from eating disorders. Most recently, $9 million was announced in the 2023-24 budget to support children to build and maintain positive body image and to extend existing support for eating disorders. Broadly, the key initiatives include, and many of you will be familiar with them, Medicare subsidised services for people with diagnosed eating disorders, and a treatment and management plan. 20 million in community grants to deliver innovative eating disorder treatments, intervention services and supports in community settings. And the Australian Eating Disorder Research and Translation Centre to identify new and innovative eating disorder treatments. And of course, ongoing support for the Butterfly National Helpline, providing free and confidential support over the phone and via email and online to over 20,000 people each year. Together, I genuinely believe that we can have an impact, and that baton that Zoe's carrying, that lived experience of Susan for more than 20 years and equally shared by Andrew and others in this place, I know that together we will, working with you in this room and others across Australia, be able to see real change and have an impact. So thank you for your work and congratulations on today.
It's a long way to the podium here. Thanks so much to Assistant Minister McBride for her words, and also to the Parliamentary Friends of Awareness Group. It actually is really inspiring as a member of the sector to hear that kind of engagement. It's really supportive, and it takes us forward. I'd like to introduce now to you Senator Anne Ruston to talk to us. Thank you.
Thank you very much for the opportunity to be here this morning, and I too would pay my respects to the traditional owners of the lands on which we meet today, and pay my respects to elders past and present, and extend that respect to any Aboriginal and Torres Strait Islander people in the room. Can I acknowledge my parliamentary colleagues, particularly Emma and Zoe, Andrew and Susan, the co-chairs, for what you do to raise the profile of what is quite an insidious mental health condition that sadly manifests itself in a very, very serious physical outcome. To Jim Hungerford, thank you very much for the work that you do. We met yesterday and had a very sobering conversation about some of the statistics that are in today's report. To Mel McIntosh, my Shadow Assistant Minister, who is an absolute powerhouse, and I thank her so much for doing half my job for me. But can I I suppose today is all about acknowledging not just the 1.1 million Australians who've been clinically diagnosed as having an eating disorder, but however many more are living with an eating disorder that haven't been diagnosed and haven't been able to seek treatment because they don't actually, they haven't been in a position to seek that help. And to the many millions more, as Zoe said, the families, the friends, the people that they work with who are impacted by this terrible condition. It makes for a very, very big number. And for that reason, I congratulate the Butterfly Foundation and those that have worked on this report, because when you consider the impact of so many lives in Australia by eating disorders, you can see why it is so important that we actually have a base foundation of knowledge and data on which to build where we go forward. But can I say that a couple of things that I saw in the report that were really quite sobering to me were the age of young people that are getting younger in terms of the people that are impacted by eating disorders, but also older Australians who are impacted by eating disorders, which makes it very, very clear to everybody that eating disorders affect everybody in Australia. It is not something that is just specifically designed or specifically impacting on one demographic, one age group. It is something that is a population-based national issue, and we need to start treating it as the epidemic it has become in our country. But one of the things that I'm absolutely passionate in doing from my role as Shadow Health Minister, and I know, and I'm sure Emma would agree with me and her other Health Minister colleagues, that we've got to stop this from happening in the first place. We have to focus on prevention, and the only way we focus on prevention is if we get an understanding of why this is happening in the first place. And so I commend you for making research such a strong pillar in what you want to do going forward. So can I say that there's many, many things in this place that we can fight about as opposition and government and opposing parties and those across the political spectrum, but this is not one of those. And so I acknowledge my predecessors in the coalition governments that have gone before for their work on eating disorders, but I also commend the current government for the work that they're doing to make sure that we don't lose the momentum that has been started. But there's so much more to do, as you obviously know from the release of the report today. And finally, can I acknowledge Chantel and Sarah? I can't think of anything that must be harder than actually getting up here and revealing something so personal and intimate as a journey through a health situation, particularly one that has obviously started off as a severe mental health issue that has then manifested itself in quite significant physical implications for you. So to Chantel and Sarah, thank you. Without your voices, nobody really understands. Otherwise, it's just a report, it's a document, it's a piece of paper. It's the real voices of people who actually can stand there and tell them what actually happened to them changes the dial in terms of the ability to convince those that make the decisions, those that have got control of the purse strings, about opening up those purse strings and making sure that we're making the investments in eating disorders that obviously this country needs to make. So finally, congratulations to the Butterfly Foundation for what you've done, for your advocacy and your continued work in this area. It's been a long journey, and I just hope that this new report gives you the impetus to be able to convince all of us of the need for greater investment to make sure that we stop our young Australians from having eating disorders so that we have no older Australians with eating disorders. So thank you very much.
Thank you very much, Senator Ruston. And again, I just want to reassert, I hope on behalf of the sector, how heartening it is to sense the genuine understanding of the predicament of people who suffer from eating disorders, and also the bipartisan support is just much appreciated. So thank you for affirming that. I'd like to invite our panellists to join me up here for a discussion and question and answer. We will dive a little bit more deeply perhaps into the methodology and findings, specific findings of the report, and we'll also bring to life what these numbers mean for people living with the reality of an eating disorder on a daily basis. So please welcome Chantel Lacrosse and Sarah Cox, both lived experience advocates who contributed to the report and have generously agreed to share their experiences of the costs of their eating disorders. Also Simone Schung, partner at Deloitte Access Economics and lead of the Health, Economics and Social Policy team in New South Wales, who'll break down some of the key figures and themes for us. And Jim Hungerford, Butterfly's CEO, who can speak to the change, some of the change that we need to see. So, thank you so much for joining us and for the conversation we're about to have. And hopefully there will be time for a few questions at the end, so please do line up the question that you would like to ask. Just before we start, too, Chantal and Sarah and I talked last night, and I got a sense of the depth and breadth and of their experience and really what they know and what they have to share. I'm going to ask them some really specific questions about costs now, but they're both really happy. If people have other questions around their lived experience and about their understanding about eating disorders, which is deep and profound, they're happy to chat afterwards as well. So we're going to start though with you, Simone. Can you give us some background on the report and some key findings? Yeah.
Sure. So as everyone has mentioned, this is the first report of its kind in 12 years, and since then we've found new data. We've been able to break down eating disorders by different types a lot more, and there's just a better understanding of eating disorders out there. At the highest level, if you've read the report, we essentially estimated the number of people living with an eating disorder and the likelihood of, or the increased likelihood of accessing different services like health services, needing informal care from family and friends, having their employment and well-being impacted, and then put that into a dollar value. So that's essentially the high-level approach. I think everyone sort of mentioned the high-level numbers, but there's a couple of trends that I wanted to really highlight. Eating disorder is much more common than we might think. If you look around this table, 1 in 10 people has had or had an eating disorder in 2023 in their lifetime. So that's one person on every table had lived with an eating disorder in their lifetime. As a lot of people have also mentioned, eating disorders affect women much more. They're two times more likely than men to have an eating disorder, but also younger people, we are seeing a trend, are having eating disorders more commonly. So 15 to 19-year-olds are 2.7 times more likely than the rest of the population to have an eating disorder. We've sort of talked about the $67 billion in total cost. That's equivalent to $61,000 per person per year. So it's a great financial cost to individuals living with eating disorder. But one of the things that we need to kind of split out is it's $20.8 billion in financial costs. That's to the economy, in health system costs, productivity losses, income losses, etc., and $46.1 billion in well-being costs to individuals living with an eating disorder. And this doesn't include all of the costs associated with families and carers as well who are impacted. If we look at some of the trends from 2012, we've seen an increase in prevalence by 21%. So that's increasing the number of people with eating disorders, and the cost has increased by 36% in like-for-like terms. We've also, in this report, been able to break down eating disorders by the different types. So you'll see in the report the breakdown by all the different types of eating disorders. And we know that anorexia, bulimia are high costs, but we also know that a lot of people with an eating disorder have binge eating disorder and other eating disorders. So those are kind of the high-level trends that I wanted to highlight.
Thank you, Simone. Great job at highlighting some of those trends, and I think one of the really big contributions of this report is the breakdown, is starting to really look in more detail around what's happening across the different diagnoses. So there's a diversity to it that's really important and kind of myth-busting, as well as being enormously helpful. And I just know the report that the last Deloitte report has been a really major tool in the sector, and I'm sure this one's going to be too. So thanks so much for your work on that, Simone. Let's turn to you, Chantal, now. I wonder, can you bring these figures to life a little bit for us by talking through the kinds of costs that you've experienced over the time?
Absolutely. I have notes because I won't remember this breakdown, but everyone's going to hear a lot of facts and figures today, and so I'm really only going to touch on the basic actual numerology of everything. But the cost of my eating disorder currently makes up about 20% of my annual income. Even with Medicare rebates, private health insurance, just accessing a therapist fortnightly, and quarterly psychiatrist sessions to help manage medication and other specialist referrals and things like that, and quarterly dietitian sessions run up a cost total of $11,738.90 a year. Across the year, I lose about 80 hours of paid work accessing treatment, which equates to $3,400 in lost wages. And once you include travel costs, that adds another $1,200 to the bill, bringing a total cost of $16,338.90, which is about $314.20 a week. And I'm not even accessing all of the support that I need, and that doesn't include medication or other supporting things that I need in order to help me navigate what I deal with on a daily basis. This is, for a lot of people, a lifelong and chronic situation that they have to deal with that often brings on additional health conditions, and many people also have co-occurring health conditions. For me personally, I was diagnosed with autism and ADHD about 2.5 years ago, and through that diagnosis, I've also learnt more about how my eating disorder kind of occurred. It's taken a lot of different iterations throughout my life, from a very young age, navigating up until adulthood, where I thought I was through it, I thought I was healed and on recovery, and then I realised that I was participating in very obsessive disordered eating on the kind of health, clean eating spectrum, which is very easy to slip into, and finding the balance between meeting my support needs as an autistic person with routine and a sense of control is also really difficult in trying to balance, and I do need that additional support. That addition of having to deal with financial stresses exacerbates that too, which makes me more likely to go into relapse whenever I'm struggling with maintaining work and navigating a daily life and even just having a social life. And I think, Sarah, you can probably relate to this as well. We just want to live, we want to have a life, and we would like to have a life that exists outside of having to navigate our day-to-day health needs.
Thank you, Chantal. What a wonderful and clear and concise account of some of those costs. And I think another aspect that I really pick up on what you're saying too, and it's really important as we move forward, is co-occurring conditions and understanding that eating disorders often don't exist in isolation from other aspects of life. And that's going to be really important as we improve the system of care. We need to really improve a more holistic and a more connected and coordinated approach to those things. I think that would help, yeah? Thank you so much. Sarah, the report highlights a lot about the healthcare costs. Perhaps you could say a little bit about what the healthcare costs have been for you, and also productivity costs. I think that's another real insight in the report.
Yeah, so I am someone who developed an adult onset eating disorder. My anorexia developed when I was 29. Prior to my anorexia, I worked full-time. I was a foster parent, and I also volunteered in my local community. When my eating disorder continued to spiral out of control and I was not able to access the services I needed to get better, I ended up having to have over 8 months off work, and it took me over 2 years to build back up to being a full-time worker. So I went from being someone who was significantly contributing to the community to someone who was costing the community a significant amount of money purely because I could not get access to the supports I needed. I spent over $100,000 to get better. I am very fortunate to say I sit here now recovered and I'm in an amazing place, but a big portion of that was I had to access money from my super. I almost lost my house. part of the reason I got treatment was because I was fortunate enough to get a bursary from Butterfly to attend Wanda Nerida. But despite all of that, it still cost me 6 figures to get better from my eating disorder. And unless there is significant investment by the government, it will continue to cost more and more and more. And every dollar you put in, you're going to get a lot more back. So yeah, I think for me it was just, it took my whole life. I almost lost my home, I almost lost my job, I almost lost my child. And that level of cost is just beyond. I got to the point where I didn't want to be alive purely because I couldn't get access to the treatment I needed. So, and you know, I was someone who I had access to public treatment, it just was not at a sufficient level to take me to a point of recovery. I was a revolving door. I had hospital admissions in the double digits, and they would admit me, they would medically get me on par, and they would send me back home. So it was just this real revolving door, and over time, it just built and built and built and built and built. You know, not to mention, those 8 months I was off and then building up, I was on workers' compensation. So everything just continued to build and build and build. But now that I'm recovered, once I got access to the treatment, I'm now working full time. I'm now able to volunteer in my community. I have my life back, and it was because I had access to the treatment I needed, purely because I was privileged enough to have superannuation, to have funds to access and fund my own treatment. And for the vast majority of people with an eating disorder, that's just not their reality. They have no choice but to stay stuck in their eating disorder because they cannot access the help and the support that they need without appropriate government funding.
Thank you. I'm really sorry that it was that hard, and it shouldn't be that hard, and we can do better. Jim, what do the findings mean?
Well, I think for me, the findings, we speak about the dollars and we speak about the numbers, but the findings really reflect the people. And I just wanted to say thank you to Sarah and Chantal for being willing to share your story, but also to have the determination and the bravery to actually go through your journey, because we know for the 1.1 million Australians living with an eating disorder, less than a third of them are able to reach out and willing to reach out and to get the help. And clearly, people receiving help, some people are able to go through to full recovery and to be able to live the life that they want to have. Many are unable to. And I think that we talk about the well-being losses, you know, the bulk of that $67 billion. That well-being loss is people's lives, the ability for people to be able to live the lives that they should be able to, and they can't because of eating disorders. And the thing that really struck me out of the report was that with only 30% of people currently reaching out for help, everyone should be reaching out for help, but if they did, it would totally crash our health system. We're already overstretched in mental health, let alone having another 700, 800,000 people reaching out for help. And so I would really like to echo the calls earlier on this morning. We have to invest much more into prevention. We have to be able to get in there early with young children. We need to reach out to the community and try and prevent this horrendous increase that we're now able to document, both in number of people and in the financial impact. And so we are going to be calling on the government, and hopefully with the support of the opposition, to invest going forward $12 million a year in prevention campaigns, both universal campaigns in schools, but also community-wide health promotion campaigns to try and reduce this horrendous impact that eating disorders are taking on Australia.
Thanks, Jim. Well said. I wonder, for you two, Chantal and Sarah, I wonder, you've both spoken about sort of eating disorder experiences that started quite early in your lives, one way or another. I wonder what your views are about the community's awareness and education around eating disorders, And would it have helped, if there was more understanding, if there was more information earlier?
Absolutely. Both of us were children of the 90s where thin was best. I had to really unlearn a lot of things that I had been taught as truth. A lot of things that I had been taught as, if you're a healthy weight, you're healthy, which is complete garbage. Things like certain foods are bad for you. No, they're not. There is so much myth that is not just evident in children, but continues to be perpetuated the whole way through. I work in education, I work with young people, and every day I sit in classes and the curriculum teaches kids about diet culture. So we need to start from the beginning, and we need to teach young people and children to have a healthy relationship with food and a healthy relationship with their bodies, or we are just going to continue to see exponential growth to a point where we can't pull it back.
Thank you, Sarah. And Chantal?
Yeah, absolutely. My experience with disordered eating and eating disorders started from quite a young age, and I see it so prevalent in my family as well. It is quite often so normalised, a lot of the behaviours that are some of those early signs of disordered eating, and often you get rewarded for participating in those behaviours, and it can really, really mess with your sense of self, with your sense of love, with your sense of what you value as a person. This is definitely a cultural and social issue as well that stems really deep into so many different areas of who we value in society and how we value the people who participate in specific ways. And I think that early access to education in having a deeper understanding of different types of people and different types of bodies and the different types of ways that people exist and have to navigate the world will definitely have a huge impact in the way in which people have an understanding of who people are and who's deserving of having access to treatment and support that they deserve.
Thank you.
I was just going to add to that. I think another part of it needs to be upskilling of medical professionals across the board. I am someone who sought help a number of times, and one of the biggest hurdles I found was the number of medical professionals who said, "You are overweight, you cannot have an eating disorder." I was sent home numerous times from hospital with a weight loss meal plan. So I think education needs to happen across the board, not just with the society, but also medical professionals who for so long have had the bill of sale of weight equals health. And we now know that medically that's not correct. And I think that upskilling also needs to happen.
100%.
Can I add? Yeah. I just also want to add on top of that as well. So I have never received official support for my eating disorder. Everything that I have had to navigate, I have done alone or with the support of organisations like the Butterfly Foundation. The only reason that I ever sought help or even thought that there was help out there for me was because back in the late 90s, early 2000s, Butterfly Foundation had those little butterfly bracelets, and I just thought they were cute, and I got one. I had no idea what it was associated with, and I just so happened to turn around the wrapper on the back and was like, oh my gosh, there's a website that I can access, because the only community that I knew about was on the depths of Tumblr, pro-anemia stuff, which is a horrific, dark place which really keeps you in the depths of your eating disorder. But having organisations like Butterfly Foundation out there who are elevating voices of people with lived experience and showing people how to navigate things, not just for the people who are in the depths of their eating disorder, but also for families, for educators, for healthcare practitioners. This is so important, and it's just out there on the internet for anyone to access. So, yeah.
Thank you, and I bet that warmed the cockles of the hearts of everyone from Butterfly, and so it should. From Claire, from you, all the way through to you, Jim, and all of the people who've contributed all the way through, and also the other people, colleagues who sit around here today who are doing the same work in jurisdictions and states, making it possible for people to make the bridge, particularly in the context that we're struggling with mental health and mental health professional literacy. still in this area, and we see the effects of that. Does anybody have a question that you would like to ask one of the people on our panel?
Sorry, I'll just bring it.
I'm a trained nurse, and so, and have a lived experience as a parent. But it's when you're admitted to hospital, because this illness actually gets you admitted into the hospital, not the psychiatric ward, because there's no training. Like, I've visited patients, and I cannot believe the cost of that patient being in bed for 3 months by themselves with a nurse 24 hours, and those nurses don't know the 4 basic things that they should be taught because they're looking after the patient with the eating disorder. They don't know that the feeding should be orange when it's lemon. The patient is losing weight. They're actually exercising in front of the nurse that is sitting there looking after them. They are not taking their medication, and it's 4 basic things that they need to know. You could teach it to them in 45 minutes. And the cost of that is ridiculous.
I spent a lot of time inpatient, and I can tell you I was in 8 different facilities. The only facility that managed to catch and stop every eating disorder behaviour I had was Wanda Nerida. And every other place, despite having one-to-one supervision, I was actively engaging in eating disordered behaviours because my nurses weren't trained. I had nurses asking me for diet tips. They don't know what they're doing. They don't have training. No, it's not available to them.
Thank you.
Thank you,
It's an
bless you.
absolutely crucial point as we move forward. The work in tertiary courses and the work to also educate people within eating disorder specific services is ongoing. Sarah's nodding at me because we all try to do this, and we'll do better. Claire.
Thanks, Beth. I just want to talk about prevention and particularly what has happened in the field of genetics. Like, we all got very excited a decade ago, perhaps, that we found the gene. And during COVID, my 2 eldest granddaughters both got anorexia. So here we go, I've been through it 3 times. Myself, my children, and now my grandchildren. And thankfully, because services have improved, and this is the up service, we access public health in Melbourne, and it was, I have to say, absolutely amazing. And though, yet, I'm so proud of the staff at in Moorabbin. They were so incredible at Kim's, and you know, it was tough, but they got through it. But what I'm really, and they're good now, they're really, really good. I mean, you still live with it, don't you? Like, you know, here am I at 68 and I still don't prance around and look in the mirror and think, wow, you're hot today. But at any sort of negative thought that I have about myself or body goes in about 2 seconds because I've got the skills through age, I guess. But I really want to know why we aren't grabbing this knowledge of the genetics and harnessing those children who are probably carrying the gene and getting in there really early with the GPs. There should be some screening, not just with first, mental health for first aid, mental health, but for the ones we know that have got a really good chance of developing an eating disorder. We should be getting in there and doing whatever we can to help them resist it. That's all. But also I want to thank Butterfly and the government for absolutely everything. And I'm sitting here today and I'm going to burst into tears because I'm so proud.
Oh, that's so good. And I'll take that as a comment, Claire, and thank you. Thank you for that.
I think first of all I would like to really thank Sarah and Chantal for generously sharing what they've shared with us this morning. My question is, you talked a little bit about being children of the 90s, I relate, and the idea that thin was in, and I think that it's probably correct to say that that trend is coming back in fashion and media. So
Low-rise jeans.
Yeah, it's not for me, thank you. I wonder if we think about the 15 to 19 cohort, or we think that was us, in the kind of the 90s, 2000s, and the 15 to 19 cohort being the largest group of people with eating disorders in Australia now, what call would you put out to the people in the room, either through their professional networks, as people, as family members, people both with and without lived experience? What would have been the one thing that would have helped you so much more to recover or to not enter into eating disorder territory in Sarah's case as a 15 to 19-year-old person?
For me, it would have been accurate information about set points and the fact that some people, no matter what you eat, your body will take you to the size you're supposed to be. And that was the hardest thing for me in recovery, was my set point is actually as someone in a bigger body. And no matter how hard I try, if I try to be a healthy weight, I'm going to have eating disordered behaviours. So I think it's this constant push that, you know, we've gone, okay, obesity is bad, so let's make it push the other way. And instead, we've just taught kids that they have to actively be doing things to keep their body looking a certain way. So it's the acceptance that food is nourishment, you are beautiful, and your body will be whatever it's going to be. And if you keep fighting to change that, it's not going to work. We need to move away from diets with our young people and go, let's work on broadening your food scope, introducing you to new foods, joyful movement. What do you enjoy? Let's change the messaging from being, you must move 3 times a week and eat these foods or you're not healthy, to what makes you happy? Let's get out and get moving and doing what you love. Let's learn to eat different foods and keep our bodies nourished and balanced. And communicating all of that to our young people is going to be far more powerful than just being like, well, don't get an eating disorder or ask for help, because we need to have an entire culture shift.
I think for me, that specific cohort, there's probably 2 places that cohort spend a lot of their time. One is school, the other is the internet. I would like to see actual meaningful education reform in terms of if kids are teaching, getting taught home economics, it's great that they know how to make cinnamon buns, but what about how they learn about nutritional values, about how to have a balanced diet, and especially learning how to do that on a budget as well. Often nutrition goes out the wall once finances come in, and people from wide different range of socioeconomic backgrounds have to deal with these sort of things. The other one is the internet, better legislation around protecting types of content that goes out on social media, better reprimanding for misinformation and disinformation. This is a huge issue that interlays into so many different aspects of people's lives. This isn't just a health issue. This is a policy issue. This is an education issue. This is a public service issue. And even making sure that community services that are out there that are supporting kids in after-school programs who parents have to work, or who are from low socioeconomic backgrounds, or even regional areas, have access to information where they can learn and gain support and have better knowledge, so that they can be fully well-rounded, beautiful people that can contribute to their community. Because that's the saddest thing about this, is that there are so many incredible people out there who have an eating disorder, who have co-occurring disabilities and things like that want to be out there in their community contributing and sharing their knowledge and sharing their experience and really making a positive impact. But because of the barriers of them actually being able to access these things and participate as a human being in society, they just can't.
Thank you. And Simone?
Yeah, I was just going to reflect on some of the comments that's been made so far, and through my work in this project. I'm a mum, so I have a son who's 2.5, and I think one of the things that I've noticed is also educating parents from a very young age. There's so much information about nutrition, about what I should cook, what I should give my child, and it's a lot of mixed information. So I think, being able to educate parents as well from a young age. The second thing that I also notice is, I guess, understanding cultural differences in how we think about eating disorders and disordered eating behaviours. I come from an Asian background, and it's very open in discussing people's weights, and when you see your extended family, you know, people comment on your weight. And I think just understanding, you know, me and my cousins actually did used to take laxatives as a thing that we did together. And so understanding how different cultures also experience it and how you actually diagnose it or recognize it, I think would be really useful.
Thank you for those really practical suggestions. As we finish the panel, just want to notice the complexity, isn't it, that we must hold and yet we must act. We must hold the genetic power, we must hold the social kind of power and determinants, and we must hold the cultural understanding and the kind of what that means across different sets of people in Australia as we come into action. I'd just like to thank... one more question?
Well, okay. Thank you, Beth. That was a beautiful summary. So I actually I said forget the question, it doesn't matter.
You're right, Sarah.
I'm all right, okay. Oh, look, I wanted to congratulate Jim and Claire and all of the Butterfly family. The last report prompted a national conversation and a whole set of action, and this will too. Chantel and Claire, Chantel and Sarah, I'm actually terrible. Everything that you've said, but absolutely integrated health promotion messages for obesity and eating disorders they're working in opposition. I've written lots of grants to try to fund research in this, and they never get supported and funded. We can act and we can have research alongside it. We don't need to necessarily wait. There are lots of sensible things that we can do, so I totally agree with that. I was actually just going to try to answer Claire's question. The reason that the genetic research is not having the impact that it should is because it will take us, at the rate that we are funded to collect the samples, 20 years to have the number of samples that depression have that allow you to reliably collect a polygenic risk score in order to be able to determine who is at risk and offer that level of protection. So that is an investment in research issue, and we've covered that today, but that's the reason. Yep.
Thanks, Sarah. And let's take a moment just before we close off the meeting to put our hands together to thank our panel. Great job, everybody. Look, in closing, if you'll forgive a couple of comments, this moment is actually a really important one for the eating disorder sector and for all people impacted by eating disorders. We have a shared understanding of the full range of services needed from prevention through to acute care. We have a detailed roadmap in the National Strategy 2023 to 33 for building the full system of care. We have committed and effective national and jurisdictional eating disorder lived experience and service development organisations and champions who are increasingly working in coordinated ways. We have inspiring and directional information coming from research, and to which Paying the Price 24 makes a powerful contribution today. Governments have committed and invested in the development of an effective and equitable system of care. What we have to do now, and I'm not the first person to say this today, is we need to build on the capacity and momentum. If we don't do that, people experiencing eating disorders will miss out again. If we do invest and continue the hard work of regional, state and territory and national system building, we really have a chance of shifting the dial forward in a very real way and making decisive positive change in the experiences and outcomes of all Australians at risk or experiencing eating disorders and their loved ones. Again, congratulations, Butterfly, on shining a data-driven light on the social and economic costs. Paying the Price 24 will be widely utilised, there's no doubt, and will inspire and support crucial action. And thank you all, speakers and audience, for being here today to help launch Paying the Price 24, building the conversation and the connections and moving towards much needed change. Thank you.
look, it, you know, it was really nice to be here. Like, really.
It's nice having so many people from
Yeah, and listen, you two